So our next speaker is Dr. Kate McLaughlin, who is a clinical psychologist and professor of psychology at Harvard University. Thank you, Dr. McLaughlin, for being here. And can you share with us some of your work that you've been working on, particularly as it pertains to life adversity and other work related to social cultural factors? Oh, you're on mute.
Can you hear me now? Can you hear me? Yes, okay, good. Sorry about that. So to start, I'll just say I have no disclosures to report. And the primary message I want to communicate with you today is that the roots of many of the health disparities that we've been discussing begin very early in life. So we know that approximately half of children in this country will be exposed to trauma or another form of adversity, such as abuse, neglect, domestic violence, parental separation, neighborhood violence, or chronic poverty by the time they reach adulthood. And we know that these forms of adversity are potent risk factors for mental health problems like depression and anxiety, but also a wide range of chronic diseases, including most of the leading causes of death. These early life experiences continue to exert powerful effects on health even decades later, such that each additional adversity a child experiences is associated with an increase in risk for the onset of many chronic diseases and even early mortality. We know, unfortunately, that these kinds of adverse experiences disproportionately occur to children who are raised in poverty and in historically marginalized communities because of structural racism, disadvantage, and widespread parental incarceration. And in this way, childhood trauma and adversity not only harm lifelong health, but they're a fundamental driver of health disparities. So I want to talk about a couple of the biological pathways that we've learned seem to explain these powerful links between the early environment and later health. So first, we know that childhood adversity's impact on health can be explained not only through changes in behavior, but by alterations in the way that the brain develops, as well as other biological systems, and that these changes are observable as early as childhood. So early in life, our brains are remarkably plastic, which means that they can easily be shaped and changed by our environmental experiences. Over the past decade, we've learned that experiencing adversity in childhood can lead to numerous changes in brain development. Many of these changes, I want to emphasize, help children adapt to a stressful or harsh environment. However, they also come at a long-term cost in terms of increasing risk for physical and mental health problems later in life. We've also learned that exposure to trauma and adversity early in life can actually accelerate the pace at which the body ages, contributing to the onset of many health problems later in life. So we've known for decades that kids who experience trauma reach puberty earlier than their peers who haven't experienced adversity. But more recently, we've learned that early life adversity can actually accelerate the pace of aging at a cellular level, meaning that the body literally ages more quickly in children who've experienced early life adversity. So these changes in brain and biological development are examples of what we call biological embedding of the early environment and are key mechanisms that contribute to health disparities. However, I want to end on a more positive note by highlighting that the negative health consequences of adversity are not inevitable. In particular, I'm going to highlight a recent paper from my lab suggesting that the magnitude of these health disparities is reduced substantially in states that have a more generous social safety net for low-income families. So in a recent paper using data from over 11,000 US children, we found that socioeconomic disparities in mental health, but also in brain development, were reduced by 1/3 to 1/2 in contexts where there were more generous policies and greater support for low-income families. So this work suggests not only that the health consequences of early life adversity and poverty are not inevitable, but there are feasible policy solutions that can help to mitigate these long-term negative consequences if we have the political will to make them happen. Thank you for having me.
Thank you, Dr. McLaughlin. And again, a reminder of those upstream determinants that can affect, quite all of these outcomes.